Good morning, and thank you for inviting me here this morning. What I'm going to talk about this morning is national health care. There is a movement in this country, it's more like a train wreck waiting to happen, which is to move us into a single-payer system. Mr. Obama or Ms. Clinton are elected as president of this country, we will have a single-payer system in this country. What does that mean? That means we will have national health care like the Canadians, like the French, like the British. How did we get here? Well, those on the left, when they want to create a situation like this where we need more government in our lives, have to create a crisis. And that crisis they've created is that we have 43 million uninsured people. That's what you hear from the media. That's what the politicians repeat. That is what we hear. The reason for having to move to national health care is we've got 43 million uninsured. Let me tell you that we don't have 43 million people uninsured in this country. Let me break it down and explain it to you. We have 8.3 million people in this country who make between $44,000 and $74,000 a year. They choose not to buy health insurance. I didn't say it was smart. I said it's what they do. All right? We have another 8.7 million people in this country that make $75,000 or more a year, and they choose not to have health insurance. Again, I didn't say it was smart. I said it was a choice. Okay? There are communities like the Amish and other people who directly negotiate with hospitals and people in their community for their coverage. They will no longer be allowed to do that. You will no longer be allowed to make a choice. Do I want it or don't I want it? What do I want or what I don't want? You will be told what you will have. There are 13 million illegal aliens in this country, and those 13 million illegal aliens are fed into this number by the Census Department. Well, if you think they like it here now, wait till the sign goes up in Tijuana, free health insurance in the United States of America. Okay. That number will probably jump to 26 million fairly quickly. That leaves 13 million hardcore uninsured in this country. So there is a problem. I'm not saying that there isn't a problem with uninsured. There are 13 million people who, through no fault of their own, cannot get health insurance. Okay? They can't buy it because they can't qualify for it or they can't afford it. How does that problem get solved? Well, the politicians would have you believe that it's a very difficult situation and we need a massive government program in order to make this work. In reality, we already have a program right here in Kansas. It's called KHIA, the Kansas Health Insurance Association. How does that work? It's a guaranteed issue policy to anybody who cannot get health insurance because they're declined for underwriting reasons. The problem is that it's horrifically expensive. If you're 50 years of age or older, it's going to run you probably $700, $800, $900 a month for a premium. It's ridiculous. Part of the problem is it's not being made affordable when it can be made affordable. You pay, if you have private health insurance in this state, into your health insurance policy a premium tax. That premium tax is then paid to the state of Kansas. In Kansas, that premium tax that's paid in is $14 million a year. Do you know how much of that gets back to KHIA? Zero. None. Okay? It goes into the general fund, and the politicians use that money for whatever they choose to use it for. If you took the money that goes into premium tax and put that money back into KHIA, you would have a much more affordable system, even if you just took a portion of it. But that's not the way that it works. That's what it was designed for, but that's not where it goes. Okay? So that's part of the problem. So there is one solution, okay, to solving that problem, to solving the problem of the uninsured. And we'll talk a little later, I'll talk a little later about business and business insurance and small group coverage and how that can be made affordable and some alternative plans that Senator McCain and some other people have put out that can make an impact there. But let's move on. Because what we hear about this, one of the reasons why it's going to be so great is it's going to be free. Universal health care is going to be free. Well, it's free in Britain, and they pay 42% of their GDP in taxes. It's free in Canada, and they pay 41%. And it's free in France, and they pay 51%. And here in the U.S., we pay 32%. The Canadian system's going broke. It's going broke, and it is broken. Okay? They've got 25 million people, and they can't run the program and make sense out of it, and the Canadians flock to the United States to get their care. Last Saturday on the radio in Wichita, preceding my show, there's a show called Dr. Galatia. I do a show in Wichita on KNSS. The gentleman he had on as a guest was a man by the name of Mr. Baker, who runs a company called North American Surgical, and what they do is they contract and fly people back and forth from Canada to the United States and negotiate their surgical procedures that they can't get done in Canada. Kind of interesting. There was a big article in the Wall Street Journal about 2 months ago written by a Canadian, and the banner headline said, "Where will we go for health care if the United States goes to universal health care?" Where will they go? Okay. Canada, prior to national health care, ranked number 2 in the number of doctors per thousand out of 28 countries around the world. Number 2. Do you know where they rank today? 24th. In 10 years, they've dropped to 24th. The average physician in Canada makes 42% of what the average physician in the United States makes. You think that might have an impact on why they don't have enough physicians? They're importing physicians from Bangladesh, Pakistan, Iraq, various countries throughout the Middle East because they can't afford to pay them what you pay an American physician, and their physicians are migrating to this country. They have 1/3 the number of MRIs in Canada performed in the United States, 1/2 the number of CT scans performed in Canada that are performed here in the United States. And when it comes to equipment, they don't have it. We have at St. Luke's Hospital, Mid-America Heart Institute, 2 64-slice Siemens CT CAT scans, 2 of the most sophisticated machines in the country that allow you to go in and have a heart procedure done that tells whether you have blockage or not. We've got about 10 of them between here and Wichita. Do you know how many they have in Canada? 0. Because some government bureaucrat has decided they can't afford to do it and it's not in the budget. So the Canadians flock here to get their MRIs, their CAT scans, their diagnostics so they can take the sheet back to Canada and say, see, I really do have a brain tumor. I really do have breast cancer. Could you please put me on the list? There are 2 things that drive health care in this country: unit cost and utilization. It's very simple. It's not rocket science. Unit cost is the cost to get an MRI, the cost to get a CAT scan, the cost to get a surgical procedure. Utilization is, how do I get it? What's my access? Well, the way you control universal health care, since you can't control cost because it's an unlimited benefit, is you control utilization. You make people get in the queue. That's the way that it works. So in Canada, the average wait time to get a hip replacement is 2.5 years. In the United States, it's 30 days. Okay? The average wait time to have a knee scoped is a year. Okay? The average wait time to get an MRI or a CAT scan, 6 months. Now, if you're the lady that's been diagnosed or think by going to the doctor you have a lump and it may be breast cancer, you probably don't want to wait 6 months. Or as the man in Buffalo, New York recently who sent me a video of his situation, went to his doctor, found that he thought that he had an issue with a brain tumor. The doctor said, you need to get an MRI. He was told he'd have to wait 6 months. He went to Buffalo, New York. He got the MRI. He took it back to Canada and said, see, I have a brain tumor. And the Canadian said, we'll get you in about 9 weeks. He mortgaged his house. He went back to Buffalo, New York, paid for the surgery, and the doctor told him if you'd waited 2 more weeks, you would have been dead. It doubled from the time you got to the MRI here, back to Canada and back to us again. That's universal health care. You're going to get it, and it's free. You just might not get there in time to get the surgery or whatever it is you need because you might be dead. That's the way the system works. Okay?